Good evening, and thank you for joining us for Royal Victoria Regional Health Centre's Community Listening Session. This is an opportunity for us to share our vision for the future of healthcare in Simcoe, Muskoka, and get your input. I'm Suzanne Legui, RVH's Vice President, Strategy, Communications, and Stakeholder Relations, and I'm joined tonight by RVH President and CEO Janice Skot. Co-hosting this session is Innisfil Mayor Lynn Dollin, and Lynn is also the Deputy Warden of Simcoe County. And rounding out the Innisfil contingent is Deputy Mayor Dan Davidson, longtime Innisfil resident and local business owner. Thank you both for joining us tonight. Throughout RVH's three-year planning process, we have worked closely with all our local municipalities, particularly the town of Innisfil, and we are also excited to share details about our bold long-range plan. We call this a listening session because although we will provide you with an exciting update, what we are most looking forward to is hearing from you. That's what tonight is really all about. We encourage you to ask questions using the chat function. It should have launched automatically, but if it didn't, you can find that near your mute button, and it looks kind of like a cartoon bubble, and you can just type your questions into the box that appears when you click on it. And we'll get to just as many questions as we possibly can tonight. Now, to kick off our session, I'll turn it over to Janice Skot. Janice?
Thanks very much, Suzanne, and good evening, everyone. And may I add my thanks to Mayor Dollin and Deputy Mayor Davidson for co-hosting tonight's session with me. I hope some of you were able to join us through the live stream last week when we held a small gathering in Innisfil to make the highly anticipated announcement about the location of our future South Campus. There was so much excitement and emotion in the room. You got a sense that people really could see the future and its possibilities for South Simcoe, for RVH, and of course, most importantly, for our patients. It really was an announcement 3 years in the making. You're probably aware RVH's South Campus will be located right in Innisfil on an 83-acre site at the southwest corner of Yonge Street and Innisfil Beach Road, south of Stroud. And I'm sure you're all very familiar with this location. It is ideally located directly across from Innisfil's Civic Campus, the Rizzardo Health and Wellness Center, and Recreation Center. Developing a South Campus has been a part of RVH's strategy for more than 20 years. 65% of Innisfil residents already receive their hospital care at RVH, but as the population of South Simcoe County explodes, healthcare must be more accessible, closer to home. In 2019, RVH opened a variety of outpatient clinics at the Rizzardo Health and Wellness Center. And since then, those clinics have logged more than 5,000 visits. During the pandemic, RVH also operated a testing center, or testing clinic at Rizzardo. We've received so much positive feedback from area residents about the convenience of these clinics, especially for people who use our services regularly. And those clinics at the Rizzardo Center represent step one in RVH's long-range, one system, two site plan for the future. The next 3 steps will happen over the next decade. First, we'll redevelop space within our current facility, which we call the North Campus. This is also known as the pre-tower phase. We will also begin construction on the South Campus, which will begin as an outpatient health hub. Back on Georgian Drive, we'll build a large inpatient tower. The next stage of the graduated model would be to add some inpatient beds at the South Campus, all with an eye to developing a full-service acute care hospital within 20 years at the South Campus. It is very important to note the North and South campuses are completely interdependent. One can't proceed without the other. Services within the 2-campus plan are integrated, not duplicated. For example, while Innisfil residents will receive advanced cardiac care at the North Campus, their diagnostics and follow-up will occur at the South Campus. As noted, the first phase, completed in 10 years, will be an ambulatory health hub focused on outpatient clinics, day procedures, as well as an urgent care center. Then in 15 years, we'll add inpatient units that aren't dependent on an emergency department, such as seniors care or rehabilitation. Within 20 years, the South Campus will evolve to be a full-service acute care hospital with a 24/7 emergency department, birthing units, and operating rooms. At maturity, the South Campus will house almost 290 inpatient beds and include space for our partners so we can better coordinate care. Just to give you some perspective, the size of the South Campus at completion will be about the size of RVH today. I do want to note that the image you see here will not be the design of the facility. The design will be developed through further consultation with our community. But this gives you a sense of how the campus will expand over 20 years. The impact on the healthcare of South Simcoe residents will be significant. The Health Hub, the first phase of the South Campus, which will be built in 10 years, will see 240,000 patient visits a year. And you can see examples of the type of numbers of visits, including 50,000 cancer clinic visits. Once the full-service hospital opens within 20 years, the numbers increase significantly. We would expect to see more than 350,000 patient visits each year, including 60,000 emergency department visits and over 100,000 imaging scans, such as MRI and CT scans. Even with the introduction of inpatient beds, the South Campus focus will be on outpatient visits. Advanced technology will allow us to build the hospital of the future. Meanwhile, the current North Campus on Georgian Drive will be expanded. In fact, it will double in size, enabling us to focus on more acute, complex services and procedures, such as radiation treatment for cancer patients and advanced cardiac care. The North Campus expansion will start with maximizing the existing building, including the empty shelled units that were built as part of the 2012 expansion. We'll increase clinical services, including critical care, maternal child, cancer care, and mental health. We'll also expand our non-clinical building called Rotary Place, which includes our lodge for cancer patients. This will free up space in the main building for patient care. Once the 9-story inpatient tower is built, which includes additional beds and new operating rooms, we will renovate space in the current building that becomes vacant as services and beds move into the tower. In total, this project will add more than 240 beds to the North Campus, bringing our total to 630 beds. Now I want to tell you a bit about how we chose the South Campus location, because it was an extremely thorough and transparent process. Our overriding goal was straightforward: find the best location for the South Campus. RVH's site selection committee began with a 225 square kilometer area in Innisfil and South Barrie, where almost 50 potential sites were assessed. Those sites fell generally into 4 zones: Zone 1, the Highway 400 corridor; Zone 2, South Barrie; Zone 3, Yonge Street corridor south of Stroud; and Zone 4, 6th Line in Yonge Street. Through a survey in which 1,000 people participated, the majority of Innisfil residents favored the Yonge Street corridor as a location for RVH's South Campus. Technical experts assessed the sites using 23 mandatory and desirable criteria and over 2,000 data points. They also analyzed the potential impacts on road and air traffic, parking, air quality, soil and noise, natural heritage, things like wetlands and woodlots. In the comprehensive due diligence report, 10 independent technical experts all concluded the property at Yonge Street and Innisfil Beach Road is the ideal location for a future hospital. While the technical experts were doing their work, RVH was busy consulting with the community. Broad, genuine community consultation was foundational to our planning exercise, and since 2018, we have logged an unprecedented 30,000 engagement interactions. We wanted to ensure everyone had a voice throughout every step of the process. Using a variety of engagement tools, we consulted with diverse and vulnerable populations, Indigenous and Francophone partners, patients, families, staff, physicians, volunteers, and donors. We talked to people during focus groups, partner summits, presentations, coffee chats, surveys, social media polls, and interactive design sessions. RVH's innovative street team spoke with residents at farmers markets, community events, grocery stores, and even at the beach. Immediately following last week's location announcement, we embarked on phase 2 of our engagement strategy, which includes intensive site-specific consultation, as well as a robust media communication strategy. In addition to a survey and Innisfil-wide distribution of an information postcard, RVH reached out to stakeholders through radio and newspaper ads, an updated website and video, social media, and consultation with stakeholders such as Indigenous partners and environmental groups. Stakeholder input will continue to be added to our community engagement report, which you can read on our website. The 44,000 comments we received from residents to this point have informed the site location, South Campus building design, and clinical services that will be offered. Simply put, the community spoke, and RVH listened. Residents were very clear about their priorities when it came to choosing a site for the South Campus. They told us they want easy access to Highway 400 with multiple access points from main arterial roads, central to population centers in Innisfil as well as Barrie, close to Rosardo Health and Wellness Center and Innisfil Civic Campus, a flexible site that allows for future expansion, accessible by public transit in the future, ability to begin construction, including water and sewer servicing as soon as possible, and a location that minimizes the impact on communities and the environment, particularly Lake Simcoe. If you think about the community's priorities, this location checks all those boxes. As you know, this site is centrally located to communities in Innisfil, as well as the large population center of Barrie. It's close to Highway 400, so important for emergency situations. There's access to the South Campus from both Innisfil Beach Road and Yonge Street. That dual access is very important and was a search priority. Both roads will be expanded to 4 lanes within the next decade. There are also plans to widen the 7th and the 6th line, so there will also be alternate east-west routes. Access by public transit was important to residents. This site is located along a GO bus line. In fact, a GO bus stop is planned for that corner. We don't anticipate many patients will use the GO train to come to the hospital, but for staff and soon to be constructed GO train nearby is fantastic. More importantly, Innisfil is working on a long-term transit plan that includes fixed route transit, and the transportation plan identifies the hospital campus as a key transportation node in the future. It's important that we chose a site that could be serviced quickly, and in fact, key services are already in place as a result of work being completed at Innisfil Beach Road and Yonge Street. The Town of Innisfil planners confirm that planned infrastructure upgrades, including water and sewers, can accommodate a future hospital at this location. The location chosen is also aligned with the Town of Innisfil's 2018 official plan, which identifies the need for a hospital in Innisfil, and I quote, likely to be located outside of a settlement area due to its unique needs. The town has identified the Civic Campus as the future community hub for recreation, cultural, and community services. Having a hospital across the street will further anchor that location. There's no question that Innisfil is a special place. That's why people want to live here. We don't want to lose the things that make Innisfil unique. And having healthcare easily accessible will only enrich the community. The detailed site plan for this property will be developed through further community consultation. But this image gives you a sense of how we might maximize the 83-acre site. The site is more than large enough to accommodate the 3 phases of the South Campus, shown in the middle of this image, and will ensure RVH can continue to evolve and expand beyond our 20-year plan to meet the needs of area residents. There's also significant space to include associated services, such as physician or other medical offices, clinics, perhaps an academic partnership with a university or college, perhaps an innovation center. This site size was very important. RVH on Georgian Drive currently sits on less than 40 acres, and we've maxed out that property. We will be able to fully develop the Innisfil site without having to spread beyond the property boundaries. Environmental protection and sustainability are important to RVH, and the site's natural elements will be protected and integrated into the site and facility design. You can see how we will incorporate the woodlot along the west side of the property, as well as water features to create soothing views, green spaces, and walking paths that promote wellness and recovery. We will protect the wooded borders, rolling hills, and water features of the property. We'll also enhance the meadows and reinstate savanna landscapes to create new wildlife habitats. Our goal is to develop a South Campus that connects to nature and also connects to the community. For instance, a green path could go from the public plaza entrance through the building with views onto nature and out to walking paths around the woodlot. Public spaces will be important in the site plan, particularly given the campus's proximity to recreation center, sports fields, and the farmers market across Yonge Street. RVH and the Town of Innisfil have a shared vision for community health and wellness. As we develop the more detailed site plan for the South Campus, we'll actively consult with our communities on important issues such as building design and public spaces, green space and environmental protection, lighting, and parking. We'll continue to work closely with the Lake Simcoe Region Conservation Authority to ensure the South Campus plan is aligned with the Lake Simcoe Protection Plan. Our region is fortunate to have Lake Simcoe as an incredible natural resource, and its importance cannot be overstated as a source of both water and food, and of course, recreation. We know the protection of Lake Simcoe is especially important to Indigenous people. Building on previous consultations, we will work closely with our First Nation partners, continuing to authentically engage them on this project and many other issues we currently do. In fact, we have a very productive consultation session with the First Nation leaders late last week, and we've already started discussing some of their ideas. We'll consult them to ensure the site plan safeguards the environment and building design appropriately acknowledges and honors the significance of the land for Indigenous people. Some of you may ask, why isn't RVH locating the South Campus on the 50 acres of land donated to RVH more than a decade ago on the 6th line between Highway 400 and Yonge Street? While we're grateful for the 2009 donation from the Quartel Group, which was dependent on building a hospital on the site within 25 years, it's important to note that the cost of land, the blue dot inside the rectangle at the bottom of this slide, represents a very tiny fraction of the cost to construct, maintain, and operate a hospital over time. The cost of RVH's one system, two site capital project, including North Campus expansion and new South Campus, is estimated to be roughly $2.5 billion. But compare that to the ongoing cost to run a facility the size of RVH, which today is far more than $1 million a day. So to put it in perspective, the operational costs of a hospital over 50 years are up to 200 times more than the land acquisition cost. I think this image really puts the relative costs into perspective. This South Campus will impact residents' healthcare for generations to come. So I'll say it again, RVH's most important consideration during its search was that we chose the right location. Technical experts assessed all sites using the same detailed criteria, including the property on the 6th line. They all concluded that our chosen site is the best location for RVH's South Campus. You may also ask, why now? Why the urgency to develop the South Campus? The biggest driving force is population growth. The population of South Simcoe County will continue to explode over the next 2 decades. In fact, it will double. Over 74,000 more people in Innisfil alone, and we know that rate of growth has accelerated during the pandemic as people have relocated outside the GTA. Conservatively, over the next 20 years, 173,000 new residents will move to South Simcoe County, Barrie, and Springwater. That's equivalent to every resident in Oshawa moving into our area. And therefore, the total population will be equivalent of London, Ontario. And you may know that London has 2 very large hospital corporations with several sites throughout the city. That explosive growth means RVH is bursting at the seams today. Prior to the pandemic, RVH's beds were full every day. In fact, occupancy rates were consistently over 115%. There were days during flu season when occupancy hit 135%. When the beds are full, it creates gridlock throughout the hospital. Patients end up waiting for a bed in the emergency department and wait times grow. The year before the pandemic, over 3,000 patients were cared for in hallways and makeshift care spaces with no windows or private washrooms. One of the harsh lessons of the pandemic is that hospitals must not revert to hallway medicine. It just isn't safe. We also have an aging population, growing at a rate faster than the provincial average. In 25 years, Simcoe County will have over 107,000 more residents than it does today, making up almost 30% of the population. And that's an important stat because seniors use hospital services 4 times more frequently than the rest of the population and account for half the province's health budget. Our rapidly aging population is going to change our communities and it's going to substantially increase the demands on healthcare. Not only is our population growing and aging, unfortunately, we have a lot of risk factors that impact the kind of healthcare we'll need in the future. Habits like smoking, drinking, and not exercising enough means we aren't as healthy as our fellow Ontarians. In fact, almost 45% of our region's residents have a chronic condition, such as diabetes, heart disease, cancer, or respiratory illness, and 1 in 5 have multiple chronic conditions. So clinics at the South Campus will focus on preventing health conditions and promoting healthy living before people need hospital inpatient services. There is urgency to move forward with this project as soon as possible, so the opportunity is not lost. The property is currently designated agricultural, and RVH requests a ministerial zoning order, or MZO, which will align us with the government's planning process and provide greater certainty for the South Campus at this location. That certainty will also better position RVH to secure government approvals for our plan and allow us to conduct detailed site planning. Of course, an MZO does not change the requirement for good planning and broad consultation. Far from it, actually. The site plan is still subject to all strict planning policies, including environmental approvals. Having already met all provincial planning requirements for the South Campus site, an MZO would help RVH get shovels in the ground faster, bring healthcare and jobs to South Simcoe County sooner, and support post-pandemic economic recovery. Certainty around a location will also allow the RVH Foundation to move forward with its Moments Matter fundraising campaign. We know Innisfil residents want a hospital built in their community yesterday, but it's important to understand that the timeline to build a hospital is long and complex. If we are to transform this property into the South Campus Health Hub in 10 years, we must be certain that a hospital can be built here, secure government approvals for our plan, and begin construction as soon as possible. Of course, the South Campus will not only improve local healthcare for generations to come, an infrastructure project this size has considerable economic benefits too. The South Campus project will produce significant employment. At maturity, with the South Campus built and the North Campus expanded, RVH will double its workforce with 3,000 additional full-time staff. Those are stable and well-paying jobs. Most of these employees and physicians will live in Simcoe County, which means a lot of their spending stays in the local economy, spent on houses, at grocery stores, restaurants, and other businesses. We also know access to high-quality healthcare is a key consideration for the residents and businesses thinking of relocating to a community. And that ongoing economic boost doesn't factor in the construction period. Although it's too early in the planning to estimate the dollar impact, we know RVH's 2012 expansion required a staggering 1.7 million person-hours of work. And this project is 6 times bigger. 80% of the tradespeople used in our previous project were local, as were many of the suppliers. Simply put, having a hospital in your community is very good for business. We need assurance now that we can build a hospital on the Innisfil site so we can continue to work through the government's 5-stage planning approval process. We've already submitted the pre-capital submission to government, and we will submit stage 1 of our proposal this fall. We've consulted broadly with our community, and we will continue to do so. We have conducted a fair, transparent search process and done our due diligence. 10 technical experts say this is the right location. The site is aligned with Innisfil's vision for the future and also meets area residents' priorities. RVH is ready to move forward with this plan, and there's no time to waste. In closing, RVH is very excited about this project, and we hope residents are too. We're excited about the economic catalyst RVH will become in South Simcoe as one of its biggest employers, and we're most excited about what this will mean for the health of area residents, literally for generations to come. Just really want to thank you for that opportunity to speak with you tonight, and now I'll turn over to Mayor Dollin and Deputy Mayor Davidson for some comments. Mayor Dollin, let's start with you.
Thank you very much, Janice, and I can assure you that myself and council and actually all of the residents of Innisfil share your excitement. Since our announcement last week, I have had the opportunity to speak with many residents who are just bubbling over with excitement about this. So I want to tell you how honored we are that RVH and the RVH board has selected Innisfil for the South Campus location. This location is right in the heart of Innisfil, which is very important because it makes it accessible to every corner of our community, as well as our neighboring communities. It's not lost on me that only a few years ago, Innisfil residents would have to travel outside of our community, either to Barrie or Bradford for blood work, ultrasounds, or x-rays. Over the past 3 years, we've seen firsthand through the Rizzardo Health and Wellness Center just how much of a difference it makes to have healthcare services right here in our own backyard. Imagine what a game changer it will be to have this South Campus grow and evolve with new services, new technology for our residents over the next 20 years. This is such an exciting time for Innisfil, and I want to thank you personally for all of the work that you've put into this and for continuing to inform and consult with our residents through presentations like this. Thank you so much. And now I'll turn it over to the Deputy Mayor Davidson.
Oh, Dan, I think you're on mute.
Thank you, Mayor Dollin, and thank you, Janice. This is a great opportunity to shine our town. Yes, this is exciting, and I believe Innisfil is ready for this opportunity. We welcome the prospect of RVH South Campus. It can bring much needed jobs and economic benefits, but most importantly, it will bring healthcare close to home to a growing population. The RVH South Campus is a remarkably significant event in the future of our town, Innisfil. Planning is essential. Innisfil has an excellent planning team, and our staff and council look forward to working with RVH to plan exceptional healthcare right here in Innisfil. All great projects like the RVH South Campus must also cultivate a sense of community. That is why I look forward to having the input of Innisfil residents in a participatory planning process. I always believe before we move too deeply on planning, we talk to our residents first. Planned with the citizens of Innisfil and the region in mind, the South Campus means that we will see a facility that matches our needs and our growth while giving future generations access to healthcare and new opportunities right here in Innisfil. And I'd just like to thank you for sharing this with Innisfil and letting us move forward. Thank you.
Well, thank you, Deputy Mayor Davidson, Mayor Dollin, and Janice. That was a bit of a whirlwind tour about what the next 20 years will look like for RVH and for Innisfil and South Simcoe, but it is important to lay that foundation for our discussion tonight. I imagine you have many, many questions, and we want to hear them. So again, if you would like to ask a question, simply type it in the question box on your screen, and we do have quite a number of questions already in the queue, so I'll just move forward with those. Our first question comes from Judy, and Judy is asking, she says, we need a second hospital in South Simcoe County now. Why will it take 10 to 20 years to get one? And Janice, we might ask, is there anything we can do to make that happen sooner?
Thanks very much, Suzanne. Yes, developing a hospital is a long and complex process. And to ensure RVH can meet the needs of area residents for generations to come, we must plan for the future. We began that with the Rizzardo Health and Wellness Center. That was our first phase. As I mentioned earlier, the next phase will be the construction of the South Campus with just an ambulatory health hub to start outpatient services and an urgent care clinic. This should all open within 10 years, though. So we're not waiting a full 20, Judy, but the 10 years. And to meet those timelines, though, we need to get the shovels in the ground as soon as possible, not those ceremonial shovels that Mayor Dollin and Deputy Mayor Davidson had last week. We know that Innisfil residents want a hospital built in their community yesterday. It's important to understand the timelines to build a hospital is long and it's very, very complex. If we're going to transform this property into the South Campus Health Hub in 10 years, we must be certain a hospital can be built here. We need to secure government approvals for our plan and begin construction as soon as possible. We don't want to risk delaying the opening of the health hub beyond 10 years. And that's why we're requesting an MZO. It would give us greater certainty that we can move forward with the detailed planning and approvals that we need.
Thanks, Janice. Fred is asking, tell me more about Innisfil's plan for the Civic Campus and how the new hospital will fit in with that. And Mayor Dollin, I think that's got to be a question for you. Oh, you're on mute.
Thank you very much for that question, Fred. Yes, the campus has evolved over time and is a really important part of our municipality. Because of the way Innisfil has evolved over the years with 9 different settlement areas, it's important that the services that everyone requires is equally available to everyone. So whether you live in Big Bay Point, like the deputy mayor, or in Cookstown, like the mayor, we're equal distance to this center, and it's available to everybody. We continue to work with the Rosardo Health and Wellness Center, and it's really been a game changer for us, and we're just opening up pieces of it that have been closed because of COVID. So the Hordinsky Community Kitchen now, there's seniors cooking classes in there and packaged meals being created, and we'll keep working on those programming areas. And of course, our own rec center and the Y that has the Heart Healthy programs there for people who have recovering from heart issues. So I really see the whole area as being intertwined and creating a great space for our entire community.
Thank you. There's definitely great alignment between RVH and what Innisfil is planning for the future. Our next question is from a business owner who says, I have a business in Stroud. How will it be affected during construction and once South Campus is open? And Deputy Mayor Davidson, you're a longtime business person in Innisfil, so let's give you a chance to take a crack at that answer.
Thank you, Suzanne. Appreciate that. As a business owner, if I was in Stroud, I'd be elated. With hospitals, people are coming from different towns, cities to visit their relatives and such, are looking for places to go. Maybe picking up flowers or bringing a packaged meal to somebody in the hospital or picking up fresh fruit for them. So I think as a business owner in Stroud, they should be elated. It'd be very good for them, I think.
Okay, Mayor Dollin, any comments around the construction period?
Yeah, well, I think that construction is something that is hard to avoid, particularly right now in that area, because as Janice said in her presentation, the pipes are going in the ground as we speak. As Innisfil Beach Road is being reconstructed, we took that opportunity not to have to duplicate it, but to use that opportunity to get the servicing in the ground when that road goes. And Simcoe County is also in the process of widening and 4-laning Yonge Street. So this will all be taking place while the construction will be on the site, but construction will be on the site, and we'll create jobs and we'll create prosperity for the businesses that are around that construction as well.
Great, thank you very much. We have a question from Hassan, who is saying, will I be able to get my cancer treatments at the new hospital? And Janice, I'll turn it over to you for that one.
Thanks very much. So the services within the 2-campus plan they're integrated, but they're not duplicated. So for example, Innisfil resident will receive advanced cancer care like radiation treatment at the North Campus, but their diagnostics and follow-up care would occur at the South Campus. So Barrie residents will go to the South Campus for some of their diagnostic care and follow-up care. And for example, cataract surgery will take place at the South Campus, which is an outpatient surgical procedure. So it'll be going both ways, from Barrie to Innisfil, and from Innisfil residents up to Barrie at the North Campus.
Okay, and as you said earlier, the services will be integrated, not duplicated.
That's
something
right.
for us to remember. All right, and Brian Davies is asking, will my taxes go up because of the hospital in Innisfil? Well, we won't touch that one, but Mayor Dollin, I'll give that to you, and Deputy Mayor Davidson.
Certainly. So taxes provincially pay for the operating of the hospital, which is why I think it was Judy asking originally about why it takes so long, because we're not the only community that's looking for hospital dollars, and everyone thinks that their project should go first. So we need to align our project with our priorities, make it a priority for the government, and we need to also have our community get behind this project so that we can all share the in that advocacy for getting this done yesterday, as Janice said. So taxes, I guess there's only one taxpayer, so your federal government gets 47% of your tax dollar. The provincial government gets 44 and the municipal government gets 9. So we will do everything we can with our 9 cents to help this hospital along.
Are there any further comments from you, Dan?
I think I agree with Mayor Dollin on that one. The 9 cents that we get left over from the feds and the province is not always a lot, but I think if we work smart and accountable, we can probably keep taxes in line and keep moving forward.
And as Janice mentioned earlier, that certainty around the site will certainly well position us for approvals and funding from the provincial government. We have a question from Karen Brown now, who says she is thrilled to see the incorporation of biophilic design. In addition, I encourage RVH to go beyond the current building code for their hospital or the future with proactive accessibility. Consider the Rick Hansen Accessibility Certification Program. While there are several commercial buildings in Canada that have been built to the gold standard, there are none in Simcoe County. Accessibility is in my professional wheelhouse, and I would be pleased to connect you with a Rick Hansen certified accessibility strategist. So thank you for that, Karen. And Janice, any further comments on that one?
Well, it's a great recommendation, and it could be one of many firsts for the South Campus in terms of how it will be designed and operate into the future. So we'll definitely be following that one up. Thank you for that.
And part of our consultation is really reaching out to those local experts as well. So we'll certainly be in touch on that one. Lenora asks, what do you mean by a health hub versus a hospital? What is the difference? We tend to talk in language that we're familiar with, but we forget that maybe not everyone is familiar with those distinctions. And Janice, that's a question for you.
Thanks, Suzanne. Thanks, Lenore. I think we do a lot of health admin speak for sure. So a health hub, which will open in 10 years, is going to focus on outpatient clinics, day procedures, day surgeries, and of course, an urgent care center. When we think about the hospital of the future, it really is about less inpatient stay and a lot more day procedures. This is going to be a very, very busy place. So we might imagine that you would receive an imaging scan at the South Campus and have day surgery there. And yet within 20 years, the South Campus will evolve to be a full service acute care hospital. When that happens, that means that there's an emergency department, and that operates 24 hours a day, 7 days a week, 365 days of the year. And there are many elements that make an emergency department function. One of them would be an intensive care unit. Another would be to ensure we have sufficient surgical, not only the rooms, but the staffing, obviously, to keep it going. Birthing units will be available. And of course, there'll be 290 inpatient beds. So we're really responding to the government's strategy to really see more and more healthcare services provided on an outpatient basis. And we do believe that now that we've secured the land and with the MZO, and then being able to really demonstrate the ability to provide significant services to South Simcoe through a health hub versus a traditional inpatient hospital to begin with, we are going to get the attention of government and get this built within 10 years.
Thanks, Janice. And one of the criteria identified through area residents was that proximity to the Rizzardo Health and Wellness Center and the Civic Campus. We heard about that time and time again from people in our consultation, and we've talked about it again tonight, all the different ideas that we could have to connect the two campuses. So Habo is saying, asking whether there could be an underground pass below Yonge Street connecting the two campuses. So I'll throw that out. Janice, I know we've talked about some of the connections, and Mayor Dollin or Deputy Dan, who wants to take that one on?
I think the tunnel underneath connecting with the Rizzardo Center is fantastic. As you know, Sunnybrook has them everywhere in their hospital, use them regularly. So it's something we could look at down the road. So as we know, the winter climate can be quite nasty. So yeah, it's an idea. I think it sticks with the innovation in Innisfil. Thank you for that question.
Can I add to that, Suzanne? So I think, again, timing is everything. So while we're taking advantage of the county doing Innisfil Beach Road right now to put our servicing in, we know that the county is going to be widening and reconstructing Yonge Street as well. So now would be the time to speak to the county to see if something like that could be incorporated into the plans. And, well, we're thrilled to pieces that this is in Innisfil. We must also recognize the residents of South Barrie who also, like Innisfil, have a hard time getting to the North Campus sometimes, like on a Friday night of a long weekend. and how I think Mayor Lehman said it best when he came to the groundbreaking is when you have a heart attack or when your child has a broken arm, you don't really care what side of the municipal boundary you just want care close to home. So it'll have such a wonderful service area. Will service so many residents, both existing and the ones we're going to see here in the future.
Thanks. And maybe I could add, Suzanne, that an underground tunnel would obviously be the safest way for us to really connect and facilitate movement between the Civic Campus and the RVH New South Campus. We've also talked about other opportunities, but the safe transition between the two sites is absolutely paramount. The public may not know that on Rotary Place, which is the administrative building just outside of RVH, we actually have a tunnel that connects that building over to the main hospital, and it's used for a variety of purposes, but it's an excellent way to move people back and forth. So all these ideas are fantastic. It's early in the design phase, so it's the right time to get these ideas on the table. Thank you.
And certainly the tunnel between the hospital and Rotary Place is well used and appreciated in February, I'll tell you that. All right, we have a question from Oscar Brooks, who is, it's an infrastructure question. Can Innisfil's water and power infrastructure handle a hospital of this size? And Lynn and Dan, toss that over to you.
Thank you. I'll start, Dan, and then pass it over to you. Yeah, so we're just currently undergoing a large expansion of our wastewater treatment plant, and our water treatment plant was expanded not that many years ago. So yes, we do have the capacity within, or will have the capacity within that expansion to have servicing for the hospital. And we also have our own local distribution company called Empower, and they're right across the road as well. And definitely we will be talking to them, or the directors and the designers will be talking to them to integrate all of that. We've looked at we've had talks about things like distributed energy or district energy, making the building very sustainable and innovative, because that's what we do in Innisfil.
And certainly that was a high priority for residents as well, that we'd be able to service this property as quickly as possible. Deputy Mayor, anything to add with regards to infrastructure?
Regarding the power, I know that InPower has worked very hard with updating transformers. I mean, we have the Friday Harbor project, which is a big draw in the town. We service Southbury already, so I'm quite confident in our team there that that's not a concern them at all.
So I actually used to live in Innisfil, and it was certainly a very different place then. I actually lived not far from the deputy mayor. So here is a question. I'm concerned about traffic, as a lot of people in Innisfil are. This is from Selena. And Yonge Street is only one lane and it's already packed. What about when the 400 is closed, or during a long weekend? Mayor Dollin, you mentioned this, when it becomes a parking lot.
Thank you. Was it Selena?
Celine, yes.
Yes, so that was part of the reason why the county is widening both. So Innisfil Beach Road will be 4-lane all the way to 5 Side Road past the 400. That interchange at Innisfil Beach Road and the 400 is all being reconstructed. It's already been designed. And again, Yonge Street is being 4-laned. So we are widening the paths there. We also have the GO train service that goes by. We're going to have the GO train station very close to there. We currently have our Uber Innisfil Transit, which can be accessed from anywhere in Innisfil. It's a $4 ride to the Rizzardo Health and Wellness Center from anywhere you are in Innisfil. So all of those, and while we will, as we grow, we will be going to fixed routes. We now have the data because we've been running the Uber program for so long. We know where and when people are going, and we know the paths that they're going in, so we can make sure that those routes are optimized. So we We'll make sure that it's well designed, and even if the good thing about this location is even if a road is closed, there's another way to get there. And that's why I think it was so important to our residents when the consultation was done, was that it wasn't on a road that was only one way to get in and one way to get out. Because if you can imagine, if that road's plugged, how does an ambulance get there? So there needs to be multiple ways to approach it, and that's what we've created here.
Well, this is a very similar question. I know you're the mayor of Innisfil and not the mayor of Barrie, but you may want to take a shot at that, and then perhaps Janice can follow up. But Peter is asking, how are patients in Barrie who don't have cars expected to get to the new campus?
So right now, the GO train station goes, or the GO bus, sorry, goes right down Yonge Street. So it goes right from Barrie through to Bradford on Yonge Street. And also the south, where all of the transit goes to the South GO train station in Barrie. That is one of our Uber destinations that you can travel from there to any point in Innisfil.
Okay. Any further on that, Janice?
Well, I think it's exciting to, and I agree with Mayor Dollin about the Yonge Street access, but just imagine when the South Campus is built, that the transit can currently go through the site itself and coming from the North Campus. So we're certainly planning to see this two-site single system integration work in every way possible, including, of course, transportation.
All right, thank you. And Janice, this next question is for you as well. We'll keep you up there. It's from Ken Cole, who's saying, why do you need so much property?
Well, that's a great question. And where we're working today at RVH, we certainly wish we had more property. You know, hospitals just generally require a lot of property. We don't want to think about this in terms of 5, 10, or even a 20-year time frame. For example, Georgian Drive, we will be here next year, 25 years. And with that, of course, we're already out of property. And so we wanted to ensure that we were able to find a site that was had enough property to accommodate at least the 3 phases of the expansion, plus the associated services, those such as the medical arts buildings, the clinics, an innovation center for healthcare, and hopefully a college university affiliation. So we've learned from our experience that, and I'm sure 35 years ago when the RVH campus was chosen and we were thinking 40 acres, it seemed like a lot of space. But we really have to make sure that we can, in fact, not only manage our first phases of our plans, but really look well into the future, probably up to 100 years for sure. So that's why it's so important that the land we couldn't find land within a settlement area. So this land does need to become institutional so that we can, in fact, get on with building that campus as soon as possible. And that's really just our experience from our North Campus. Now that we have 83 acres in the South Campus, though, we're less likely to spread beyond that property boundary ever, even in the next 100 years. So we're set now. We just need to get shovels in the ground, get building that health hub, and bringing healthcare closer to home.
Well, I remember when they were talking about this property and people said, wow, that is so far outside of Barrie. Why would you even consider building a hospital there? And look at where we are today. So yes, communities change.
Can I just add to that too, is that this, first of all, this property, I had no idea. It's right across the road from our town hall, and I never actually walked back. It's a gorgeous piece of property, but it has a big woodlot on it that will be retained and will form part of the campus with the trails Janice was talking about. So all that area will remain untouched and undevelopable other than these paths of trails going through it. And I think that will add so much to people recovering from whatever they're recovering from, to have that space available to them.
Good point, Lynn.
I think we were all thinking the same thing at the announcement last week as we were looking out over that woodlot that was so beautifully colored and thinking, what a fantastic view for someone who is recovering from an illness or an injury or surgery. It's a beautiful spot, and that would be incorporated. Our next question also will be for you, Janice. It says, I live in Innisfil. Can I still go to the hospital in Barrie?
Of course you can. for example, as we mentioned earlier, even with transportation lines, we don't see municipal boundaries as having anything to do with the delivery of healthcare. So we absolutely welcome all Innisfil residents to continue to come to Barrie, and Barrie residents will end up at the South Campus in Simcoe as well. It's really just a two-site, single system, integrated but not duplicated. And those are really important words as we sort of wrap up tonight to think about how we're going to make this happen. But honestly, it's just going to be RVH at South Campus, and so everyone is welcome.
We're going to keep you up for a second, Janice, because the next one is for you as well. And it says, the site that was donated years ago will not be used. Does that site now remain in the ownership of the donors?
That's a great question. The RVH priority was always to find the right location for its future South Campus. And as we heard earlier tonight through me, that technical experts assessed all sites using the same detailed criteria, including we did have the 6-line property donation go through the same criteria. In the end, everyone agreed that the site we've chosen is the best location for RVH South Campus. It's important to note the cost of property acquisition is very small compared to the cost of construction to maintain and to operate a hospital the size of the future South Campus. So the most important goal for us was to search to find the right location because of its impact on residents for generations to come. The land that was donated was to have a hospital built on it within a 25-year period, or it would revert back to the original owners. And so that, I assume that's what will happen to the property.
All right. Well, I think you're on a roll because the next question is logically yours as well. So how many people do you think will be employed when the health hub and then the hospital opens? And that's from Wesley.
Well, there are certainly 3 levels of that employment. We should not discount the construction employment for sure. This is going to be, $2.5 billion in construction between the 2 sites being built up over the next 2 decades. And so with that is an enormous amount of economic growth for those jobs, and of course the supplies that need to come together for those jobs. And then when the entire facility has been doubled, there'll be 3,000 additional employees at RVH between the North and the South Campus. And people will live, we have great people today who live in Innisfil and come up to Barrie, and those in Barrie will be down to the South Campus. So Simcoe County as a whole will benefit from 3,000 high-paying full-time jobs. And of course, in addition to that, there are a number of physicians. Today at RVH, for example, we have close to 500 members of our professional staff. And so you can envision that being doubled as well over the next 2 decades. So there's significant employment and again, high-paying jobs. And just in picturing all of this coming out of this pandemic and just knowing how much we can do to boost the economy is really quite exciting.
Mayor Dollin, I'm just going to ask a follow-up question to you around those kind of employment numbers, and what's the significance of those kind of that influx of jobs in Innisfil?
Oh, it's a game changer for us. Before COVID, 82% of Innisfil residents who left for work left Innisfil. So we really need to get good paying jobs at home, because when people drive to Toronto and work in Toronto, they get their hair cut in Toronto, they get their dry cleaning in Toronto, they stop at the grocery store or pick up their pharmacy in Toronto. So likewise, when these jobs are in Innisfil, all those ancillary businesses will also profit from all of these wonderful high-paying jobs that are here.
Often they keep their family doctors in Toronto too, so we'll need to consider that as well. All right, we have a question from Pat. And were the homeowners on the corner of Innisfil Beach Road and Yonge Street consulted? And what will happen to the homes on the west side of Yonge Street? Certainly our consultation was very robust. Janice, I would turn that over to you.
Thanks very much, Suzanne. So as was mentioned earlier, in the first phase of our planning to determine the location of the South Campus, we undertook a significant consultation broadly through a variety of medium, including, of course, in-person sessions, on surveys on our website, et cetera, survey tools themselves. And so there would have been an opportunity, I think, for many residents in Innisfil who took advantage of those surveys to make sure that their voices were heard. So I don't think I can speak to the specifics of that group of houses, Suzanne, but I do know as we move forward and continuing to plan for our hospital, that it will be important that, again, all residents, like tonight, have an opportunity to provide their perspective and ask questions.
Thank you. And Mel B asks, I moved to Innisfil from the city because it was a smaller town. Obviously liked everything that went along with that. Is this going to change the face of the community? And Deputy Mayor Davidson, what do you think? Is this going to change Innisfil?
I don't see it changing. Innisfil is made up of several different communities, and it depends where you live. So yes, maybe the hub may change a little bit. And just to add, that hub where you're building the hospital, like if I understand, Mayor Dolan, I remember Huronia Road's going to be turned into 4 lanes. It's all, the interchange is already there for access. So as for changing Guildford, Lefroy, Cookstown, Big Bay Point, Belleward, I can't see it impacting a change in a negative way. If anything, I think it enhances it for the people's safety, how close you are to a hospital. So I see it as a benefit to the residents of Innisfil.
Mayor Dolan, anything further on that question?
Yeah, we are a growing community, and we will continue to grow. Any municipality within this proximity to the GTA is going to grow, but we just have to grow smart. And part of growing smart is having the services in your own community. For years, we were a space, not a place. And now the people, they identify with their community, they love their community. And, you know, you can live in a place that is growing, but still have that sense of community. And that's the best of both worlds.
Well said. And I think that's a good spot to end the questions. We have no more. We are coming to the end of our session. And thank you for all that excellent feedback and all of your answers tonight. I want to reinforce what Janice said earlier, and that is that the level of consultation that RVH continues to undertake, it really is unprecedented for a hospital capital project. And our plan, whether it's the building design, services offered, South Campus location, it has truly informed our plan. So I hope you see your voices in it. So to close out this evening, I'd like to invite Mayor Dolan, Deputy Mayor Davidson, and Janice to give us some very brief final thoughts. So gang, in 20 seconds or less, answer this question. What will the South Campus mean for Innisfil and South Simcoe County? And Lynn, I'm going to start with you.
Thank you. The South Simcoe campus will be where your children are born, where your grandchildren are born, where your parents are going to receive care, and it will be state of the art and just a wonderful legacy that we're so happy to leave for our future generations.
Lynn, I love the comment at the announcement, the site announcement event, and you said it's where our stories will be written. And now over to you, Dan.
Thank you very much. Our town and our planning staff and council look forward to working with RVH to achieve a healthcare facility that is responsive to this community, increases our economic benefits for this community, and is, as we never lose sight of the need to protect the environment and our health of our land and Lake Simcoe as we grow. I really appreciate it. Thank you.
Thank you. And we are pleased to have you both walking alongside us on this journey. It's been quite an interesting 3 years. So Janice, bring us home. What's the impact of the future South Campus?
Well, the mayor and the deputy mayor did a great job and really hit all of the major points. But for me, it is really about bringing exceptional care closer to home, every patient, every day for that experience. And having staff who will live in the communities around this health hub, being able to be close to homes, they're close to their families, and not having to commute to have great employment and opportunities. And really is just the next step for the city of Barrie, Innisfil, all of South Simcoe. It's going to be about the size of London, Ontario, to actually really be ready for the population growth that we're going to see. And I just think it's that legacy piece for all of us as we've journeyed together so far to bring us to this point of an announcement. So very exciting overall.
Thank you. And speaking of legacy, I know the South Campus has been a priority of yours since you joined RVH 17 years ago. So congratulations on this milestone, and thank you for your tenacity on behalf of the community. So remember, if you didn't have your question answered, I don't think there are any more in the queue, but if you have a couple of thoughts as you go in bed tonight, just go to our website, rvhplannerfuture.ca. There is an opportunity there to just send us your questions. And while you're on the site, please take a moment to complete the survey, watch the video, learn a bit more about our plans for the South and the North Campus. We want to hear from you. So thank you for joining us this evening, and stay safe, everyone. Good night.